Hi, my name is Jennifer White, and I'm a licensed practical nurse in the baccalaureate program at Indiana State University. This is my health education project for community health nursing in the spring of 2021 on heart failure patients and the use of telemonitoring for continuity of care after discharge home from an acute facility. At the conclusion of this presentation, the participants will be able to 1. Define heart failure and the risk factors. 2. Define telemonitoring. 3. Identify the advantages and disadvantages of telemonitoring. And 4. Give examples of other conditions that can be monitored remotely. Please stop the video at this time and take the pretest that's available in the comments below. According to Wagner et al., 2018, heart failure is defined as any functional or structural damage to the heart that inhibits ventricular filling or ejection. Millions of Americans have been diagnosed with heart failure, with hypertension and coronary artery disease being the two main causes of heart failure. Treatment of heart failure includes controlling risk factors with the help of medication and lifestyle changes. Reducing blood pressure and controlling hyperlipidemia are priorities to reducing the risk of heart failure. The patient can also be treated for fluid volume excess with diuretics. Lifestyle changes include stop smoking, eat healthy, and get adequate exercise. This could include taking a walk daily through your neighborhood. The patient is also encouraged to reduce the stress levels in their life. Long et al. 2017 indicates that changes in the Medicare and Medicaid reimbursement structure for patients with heart failure who readmit to the hospital within 30 days after discharge has healthcare workers looking for new ways to decrease these admissions. One of these ways is through telemonitoring. Telemonitoring is a way for healthcare workers to continuously monitor patients without the need of long-term or repeated hospitalizations. Patients who have been diagnosed with heart failure can now be sent home with equipment that allow them to monitor their vital signs, their weight, and other factors, and relay this information to the healthcare worker. There are three main types of telemonitoring. The first is synchronous, which is a real-time phone or video conversation with the healthcare provider. This allows the provider to obtain subjective data that can be used to manage the patient's plan of care, allows the patient to ask questions, and allows the provider to suggest resources and literature for the patient to review so that they can better understand their disease process. Second is asynchronous. This includes the collection of data at one point in time that is stored until it can be transmitted to the recipient. Examples of this would include the patient having access through a patient portal to their diagnostic results, lab results, or any other information the healthcare provider deems necessary. Finally, there is remote patient monitoring, which may or may not be in real time, according to Ronnie 2020. The patient must have access to a reliable internet connection and a way to connect with their provider. This could include programs such as video conferencing, Duo, Facebook Messenger, and Doxime. This can be used on either a computer or a smartphone device. The patient is also given a weight scale, a blood pressure monitor, and a pulse ox. There are many advantages to telemonitoring. It allows healthcare workers to monitor a patient while they are in their normal settings rather than in the stressful environment of a hospital. Patients that are unable to travel to the hospital routinely because they live too far away or do not have reliable transportation can now be seen and monitored on a regular basis without leaving home. Patients that are too frail or too sick to leave home repeatedly can now be seen by a healthcare provider in a face-to-face meeting. Telemedicine allows for patient teaching on medication management, weight management, nutritional counseling, and mental health counseling. Patients also have access to multiple specialists and other disciplines such as physical therapist, occupational therapist, and counseling. There are disadvantages. These can include technological illiteracy of the patient, especially in the elderly. If they're not comfortable using the technology, they won't be as apt to use it as often as they should. There's also the risk of not having no access or very slow internet access. This can frustrate a patient when they're talking to the doctor and their connection buffers. The patient also needs to be aware that their healthcare information may not be confidential if a web-based application is used for the provider visit. There's also the loss of the personal touch that many people are accustomed to. Cultural beliefs may require that the patient be physically seen by the healthcare provider. And finally, telemonitoring should never be used for emergent situations. The patient must be counseled on when it is appropriate to physically go to the hospital and when it's okay to stay home and use telemedicine. There are many conditions that can be managed via telemedicine. Because of the broad range of applications available, patients with diabetes, with hypertension, coronary artery disease, and mental health issues can all be managed, at least partially, via remote monitoring. Thank you for your time.